I'm Sonia, medical officer currently working in Hospital Queen Elizabeth Sabah. I've been dealing with COVID-19 patients since June this year. I have been dealing with COVID-19 patients since June this year. This pandemic has definitely made our working environment a lot more difficult. Due to the high influx of patients and the lack of manpower, we are all at higher risk of developing emotional, mental and physical stress, mainly due to exhaustion. Youngsters are commonly affected by this COVID-19 infection, but fortunately, most of them only face mild to moderate symptoms which recover spontaneously. This is because they usually have a stronger immunity and do not have any underlying comorbidities. Hence, only supportive therapy is needed. Based on the patients that I have seen, usually most youngsters are accepting of their illness and willing to undergo isolation or home quarantine. Most youngsters diagnosed with COVID-19 infection are usually accepting of their diagnosis. Some are calm and reactionless. Some may raise concern that how if they would have affected their loved ones and family members at home as well. Regarding their mental health well-being during isolation, most of them recover well. Some complain of boredom, 14 days being in isolation, just staring at their phones, playing games and video calling their loved ones and family members at home. However, there was this one incident that my colleague told me. There was this particular cubicle in a COVID ward with 5 patients in that cubicle. 4 of them were youngsters. 1 was a middle-aged patient with underlying comorbidities. Unfortunately, this middle-aged patient actually passed on due to COVID-19 complications. Subsequently, the youngsters all have developed post-traumatic stress disorder and required mental health assessment, counseling, and so on and so forth. So, bear in mind that COVID-19 does affect patients mentally as well. In isolation wards, most youngsters do abide to the rules and follow the standard operating procedures given in the isolation ward. However, towards the end of week 1, they become more restless and agitated, and they usually ask to be discharged home and to continue self-quarantine at home. However, after explaining to them the difference between quarantine at home and being isolated in the wards, they do understand and are willing to complete their 14 days of isolation. We all know that the fatality rate among young people are relatively low. The global statistics shows that actually fatality rate among youngsters is less than 0.01%. But it can still happen, and also bear in mind that youngsters affected by this infection may then spread on the infection to people from the older age group, and they are at higher risk of mortality. I have not personally seen any youngsters passing on due to this infection itself, but I heard from my colleague she has been taking care of one young gentleman for a very long time who has underlying bronchial asthma and has been recently affected by the virus. He was unable to sustain and fight through the virus due to his underlying lung pathology itself, and he has passed on. It is very devastating to see a young individual passing on due to this virus. Hence, I really do hope that all young people actually take things seriously and comply to the SOP. On the other hand, I have come across youngsters who are actually ignorant about this COVID-19 infection. This reminds me of a patient that I have seen in my ward. This patient, Mr. X, who was actually admitted for a gastrointestinal bleed. Upon his stay in the ward, he came into contact with the patient next to him who was tested positive for COVID. Hence, this Mr. X becomes patient under investigation and requires him to undergo a total of 14 days of isolation and 2 swabs to be taken on day 1 and day 13. He refused to be swabbed. Reason being, he has a social gathering to go for the next day. He requested to be discharged without taking swab, does not want a quarantine ban on him. So I feel these things should be avoided in the community as well. My final advice to all youngsters and general public out there is that to stay home and stay safe. If you really do have to leave home for duties and so on, please make sure to wear a mask, wear a face shield, and to bring a hand sanitizer with you all the time. Please do comply to all the SOP provided. I understand that through this COVID-19 pandemic, many of you out there are undergoing stress as well. It may be due to because you have lost your jobs, financial difficulties, and many other stress factors involving your life. Please do remember that there are many counselors and psychologists out there who are willing to take you through these hard times and teach you how to cope and manage your stress. So together, let's combat this virus, because without you, we can't manage this on our own as well.